Hello, my name is Catharine Scott-Moncrieff from the Purdue University College of Veterinary Medicine. In part 1 of this video, we demonstrated how to set up a Freestyle Libre device to monitor glycemic control in diabetic dogs and cats. In part 2 of this video, we will show you how to generate and interpret Freestyle Libre reports, how to use them to adjust insulin therapy, and how to troubleshoot problems that may arise during use. The Freestyle Libre generates 24-hour interstitial glucose curves for up to 14 days, although early detachment of the sensor occurs in as many as 60 to 80% of dogs and cats. The Freestyle Libre can measure glucose concentrations between 20 and 500 milligrams per deciliter. However, the graphs that are generated in the Freestyle Libre reports do not display glucose concentrations greater than 350 milligram per deciliter. The Freestyle Libre is an important tool in patients with diabetic ketoacidosis, in patients with newly diagnosed diabetes mellitus, and in unstable diabetic patients, in which it can be used continuously until better glycemic control is achieved. The Freestyle Libre is also very useful for routine intermittent monitoring of glycemic control in stable patients. Interstitial glucose measured by the Freestyle Libre correlates well with both peripheral blood glucose measured by point-of-care glucometers and blood glucose measured by reference methods. Although overall there is good correlation, the Freestyle Libre usually slightly overestimates the blood glucose in the euglycemic and hyperglycemic ranges, while slightly underestimating the blood glucose in the hypoglycemic range. It is important to understand that there is a lag of a few minutes between changes in the blood glucose and changes in the interstitial glucose, so these measurements may differ, especially when the blood glucose is changing rapidly. In a 2017 validation study comparing the Freestyle Libre device with the reference method, the data was analyzed with a consensus grid analysis. In this type of analysis, Zone A depicts excellent correlation between a reference method and the test method, such that there is no difference in clinical decision-making between the two measurements. Zone B depicts only a small difference between the methods, such that the difference does not result in an important change in clinical recommendations. In this study in dogs, the results for the Freestyle Libre device fell within Zones A and B in more than 98% of the samples. Similar results have been shown in cats. The data from the Freestyle Libre can be viewed in real time using either the Freestyle Libre reader or a cell phone app. If owners want to use both the Freestyle Libre reader and a cell phone app, the sensor should be placed and initially calibrated using the reader, and then a cell phone can also be used to upload data. Whereas if the sensor is placed and calibrated using a cell phone, the Freestyle Libre reader cannot then be used. Data from the Freestyle Libre reader can be uploaded to a computer using free software, or can be uploaded to the LibreView website, which is also free. The LibreView website allows all the data from multiple patients to be stored in the cloud and accessed not only by the owner, but also by all the veterinary care providers in a practice. Data from the LibreLink cell phone app can also be wirelessly uploaded to the LibreView website. Once the data is uploaded, the user can generate a summary report, which can be viewed online or downloaded as a PDF. The Freestyle Libre summary report has a number of different viewing options that display the 24-hour interstitial glucose either in a day-by-day format or an integrated format. The integrated format allows an assessment of daily trends in interstitial glucose, while the day-by-day format allows better assessment of day-to-day variability. The ambulatory glucose report, the glucose pattern insights report, and the daily patterns report all display the glucose data collected over the previous 2 weeks or over the number of days since placement, and displays the median and percentiles of the data. These 3 reports are similar but include slightly different information. For example, the ambulatory glucose profile shows the amount of time spent by the patient's glucose within the different ranges. Most of these ranges are preset, but the target range can be adjusted for individual patients via the LibreView reader or the LibreView website. The Daily Patterns Report displays the insulin dose, the average interstitial glucose, the median glucose, the target range, the 25th to 75th percentile of the data, and the 5th to 95th percentile of the data. The Glucose Pattern Insights Report displays the average interstitial glucose, as well as the 5th to 95th percentile of the data, likelihood of hypoglycemia, and variability below the median. The individual glucose concentrations can also be displayed on this report by customizing the settings. In addition, the monthly summary report displays a monthly grid with the daily average glucose, the number of scans performed each day, and the number of hypoglycemic events per day. The 24-hour curves can be viewed individually in the daily log and weekly summary reports. The daily log displays all the scanned glucose results, which are color-coded depending on whether they are high, low, or in target. It is important to remember that the sensor is continuously measuring the interstitial glucose even between these scanning events. The owners can also add in additional information, such as insulin dose and notes about exercise and feeding regime. In the weekly summary report, there is less detail, but the day-to-day variability is easier to appreciate. In this weekly summary report, there is marked day-to-day variability. For example, on Wednesday, June 16th, the interstitial glucose is within the target range in the morning, but high all afternoon. While on June 19th, marked hypoglycemia is present both overnight and during the afternoon. This variability is much less obvious on the daily patterns report. One major advantage of the Freestyle Libre is the ability to collect 24-hour data for a diabetic patient. This is very helpful for determining different insulin requirements between the daytime and nighttime hours, as well as to evaluate response to long-acting insulins given once a day. On this daily log, you can appreciate that the insulin given at 7 a.m. in the morning lasts for the majority of the 24-hour period. In this glucose patterns report, the response to insulin administered at 7 a.m. in the morning is more marked, and interstitial glucose concentrations between 8 a.m. and 8 p.m. are lower than the interstitial glucose concentrations between 8 p.m. and 8 a.m. the next morning. Interpretation of individual curves is similar to interpretation of a traditional blood glucose curve, but with the ability to better appreciate day-to-day variability. The glucose nadir, duration of insulin effect, and average glucose can be easily determined. Ideally, the glucose nadir should fall between 80 and 150 mg per deciliter, and the glucose concentration should be below 300 mg per deciliter for the majority of the day. Problems that can be detected using the Freestyle Libre reports include inadequate dose of insulin, inadequate duration of insulin action, sometimes referred to as rapid metabolism, insulin-induced hypoglycemia, and lack of response to insulin. Lack of response to insulin suggests either poor client compliance or insulin resistance. Based on the assessment of the curve, a change in insulin dose or formulation can then be made, and the response assessed while the sensor is still in place. Because the glucose measurements are available in real time, clinically relevant hypoglycemia can be diagnosed and treated immediately, and the insulin dose decreased. When using the Freestyle Libre to adjust the insulin dose, it is still important to wait 5 to 7 days between dose increases. With a sensor life of 14 days, it is usually possible to make 2 adjustments to the insulin dose during the life of one sensor. Of course, the dose can be decreased multiple times if necessary. Other monitoring tools that can be used in conjunction with the Freestyle Libre device include serum fructosamine concentration, urine glucose concentration, urine and serum ketone concentrations, and measurement of glycosylated hemoglobin. Although the correlation between the Freestyle Libre and point-of-care glucometers is usually good, sensor failure or sensor errors can and do occur. If the Freestyle Libre glucose interstitial measurements do not fit with the clinical picture, a blood glucose measurement should be measured using a point-of-care glucometer or another trusted method. Another sensor problem that may arise is difficulty in keeping the sensor in place for 14 days. This is especially difficult in cats, in which the average sensor life is only about 7 days. Excessive use of skin glue can result in skin reactions in some patients. Other strategies that may be useful include careful sensor placement, use of adhesive patches, such as Skin Grip Freestyle Libre waterproof adhesive patches, and adhesive barrier wipes, such as Skin Tack wipes. Indications of sensor failure include an error message, a message indicating that the sensor should be scanned again at a later time, gaps in data, and unexpectedly wide swings in the blood glucose that do not fit with clinical signs. In these situations, if the results of the Freestyle Libre do not correlate with a point-of-care device, the Freestyle Libre sensor should be replaced. In summary, the Freestyle Libre monitor can be very valuable for assessment of glycemic control in diabetic dogs and cats. Having a good understanding of the technology allows maximum utilization of the device and can improve the accuracy of diabetic monitoring in your patients.